By now, you've heard of the study coming out of South Korea on contact tracing and spread of COVID-19 among different age groups. If you want to know more about what this study said, then this video is definitely for you. Hello, I'm Dr. James Bogash, publisher of Modern Health Myths, and today we're going to go into a little bit more detail on that particular study. Nothing frustrates me more than people who talk and share information on the New York Times or CNN or Apple News or anything about any type of study without actually going in and reading the study itself. So we're going to go in and we're going to cover some of the data on the study, and as always, I will post a link to this particular study in the comment section. And you can see that what may have been in the study, there's some pretty stark differences between what you may have seen in the New York Times or Washington Post or anything else like that. So to get a general idea of what happened in the study, I can get the slide to change. So one thing to understand is that South Korea did a very strong job of contact tracing. This involved using GPS, card-to-card transactions, closed-circuit television. I mean, they were serious about this. Wrong way. Contacts of high risk. So they identified people who had COVID-19, and they then identified household and non-household contacts for those people. Those are the contacts who were in high-risk groups, so household contacts, people living in the same household, healthcare workers, they were routinely tested in South Korea. Non-high-risk groups, only symptomatic people were tested. So keep in mind that South Korea is much smaller than something like the United States, and even a single state at this stage of where we're at, contact tracing is probably just short of impossible given the amount of people, man-hours it would take to get that done, and it's just not feasible at this point. Another interesting thing is that non-high-risk asymptomatic contents were expected to self-quarantine for 14 days. They were monitored twice daily by contact checkers. So people knocking on the door, making sure that they're still home, self-quarantining. So that information aside, so what did they find in this particular study? They looked at 5,706 coronavirus patients, and the household and non-household contacts ended up being a little over 59,000. So 59,073 people in essentially a 2-month time span from January 20th, when one of the first cases was identified, all the way up to March 27th of 2020. A couple of important things in this study is the authors admit that they couldn't identify direction of transmission in this study. So people say that, well, kids are big spreaders in here, they spread just as much, and the authors in the study contend that they really couldn't tell the direction of transmission. So it is not set in stone that it was kids transmitting to adults or adults transmitting to children. They just couldn't follow that, not like Iceland had followed, and Iceland was able to trace that very few contacts went from the child to the parent. Another little, and part of the problem then is that children are much more likely to be asymptomatic. That means it's harder to trace them if they are sick. So somebody in a household, you could have a child that's sick or exposed or positive for COVID-19 and is asymptomatic, so they don't know whether or not to check that person. So looking at the boring details of the 10,592 household contacts, only 11.8% of them developed COVID-19. This is people living together. And even when they're living together under the same roof, breathing the same air, less than 12% of the people they were exposed to in the household transmitted COVID-19. People have this idea that Okay, let me go to the next study first. Then we look at the of the non-household contacts, only 1.8 or 1.9% developed COVID-19. Like, that's a very low number given what society seems to think. From a non-household contact, the study didn't exactly go into the details, but CDC does have some ideas, and maybe they use some of those, in that somebody that you're exposed to for greater than 15 minutes and less than 6 feet. Again, greater than 15 minutes, less than 6 feet. We're not talking about somebody you walked by 5 minutes ago, or somebody you walking through an aisle at the grocery store that somebody 5 minutes ago walked through. That is not a non-household contact. If we have 1.9% transmission in a scenario where people are less than 6 feet for more than 15 minutes, what does that mean for casual grocery store shopping in Target or Safeway, going to the beach, anything? So just wanted to put that out there. Interestingly enough, the CDC also notes that in particular, this is irrespective of whether the person with COVID or the contact was wearing a cloth face covering or whether the contact was wearing PPE. In other words, the CDC doesn't care whether you were wearing a mask or not. They consider you a contact. These are the little things that people don't seem to understand when we talk about the mask debate. Even the CDC is saying, gosh, if you're under 6 feet and you're spending more than 15 minutes with somebody, like, a mask isn't going to make much of a difference. So when you look at the percentage of household contacts based on age range, like so if we had a 0 to 9-year-old, how many people in the household? So if the 0 to 9, so let's take a 5-year-old, was the index case. They were the ones who were first diagnosed with having COVID. Then I've rounded on these, but 5% of the time, somebody in the household developed COVID-19. Looking at the 10 to 19-year-old group, this was the largest. It was 19%. In the 20 to 29%, 7%. And in the 30 to 80, basically from 12 to 18% were the numbers in there. They vary based on the age range. But what's odd is that the 20 to 29 group, 7%, and yet the 10 to 19 was 19%. There certainly raises some questions about the data on that. And so let me go to the next particular slide and we'll talk about that. So it is apparent from this study that school-age children did spread to household contacts at a slightly higher rate than other age groups. The other thing to keep in mind is household contacts in general was a much lower number than most people consider. And this is pretty consistent. I mean, we've seen other studies around 20%. This one far lower than that. And the idea that everybody is going to be walking by somebody in the grocery store who's asymptomatic is just, the odds of getting exposed there, it's just not happening. But we are living society like we're deathly afraid that everybody walking by you has leprosy and you're the only non-leper in a leper colony, or the reverse, that you are the leper and everybody else does not have leprosy and they're worried about catching it from you. So just wanted to put this data out there and again point to the idea of household transmission was far, far greater than what happened outside of the household. And interestingly enough, when you cram people together and have them live in the same household, it shouldn't be a big surprise that the spread occurs within the household and less outside. But even then, those numbers were still surprisingly low, lower than we've seen in other countries. But even in other countries, we usually don't get upwards, don't get much over 20% when somebody in the household is positive from spreading it to the other members of the household. And as I've mentioned in other videos, we have some scenarios where people may get exposed but not infected. So those are some other things to keep in mind, that it doesn't mean that other people in the household weren't exposed. It just means that they weren't infected. They didn't become positive. That again plays to the role that there are some protections in place that we aren't talking about because we think that everybody has a universally equal amount of susceptibility to COVID-19, and that is just not true. Until we get that out of our minds and stop thinking that everybody is equally at risk, is the time we'll start changing. And once we start to understand that everybody is not equally at risk, that means that we can change our risk. We can start exercising, we can make sure we get sunshine, vitamin D, vitamin C, improve the quality of our diet, stop vaping, stop smoking. Those are things that clearly, without a doubt, have a role in transmission of COVID-19. As always, I will post a link to this particular study in the comments section, and make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.